Hi, I'm Dr. Rooma Sinha, consultant gynecologist, laparoscopic and robotic surgeon at Apollo Hospital, Hyderabad. So, all your dear ladies and of course the gentlemen who have joined today's program, welcome this evening to this Facebook live show on which we are going to talk on some issues of women's health. Everybody is taken up with the things that are happening around you, the kind of problems. So condition 1 is what we are going to talk about is fibroid uterus. And condition 2 is what we are going to talk about is endometriosis. So let me start with fibroid uterus. Now what is it? It is actually a kind of tumor that develops in your uterus, by and large not cancerous. How would you know that you are having this problem? As I said, you can have one of these two problems. You can have abnormal bleeding, heavy bleeding, pain, and you may be thinking, oh, it's just this period, let me watch for the next one, but it continues. And if it is happening again and again, every day, make sure you are going to look into why this is happening. So why should you worry about fibroid? Sometimes fibroids can give rise to so much bleeding that you develop anemia. And when you develop anemia, you can be weak, you don't feel like doing your work, you are irritable with your family, friends, and so on and so forth. So Sai, Sudha, Anuja, thank you for watching today. Now, when these fibroids grow, sometimes they can silently grow and you don't know that it's happening unless you go for a scan and understand that you have a fibroid. What we need to remember as women is fibroid is a very common condition in our country, in the population. If we do a scan for women in general, we'll find about 20-30% have some size of fibroid. So the question arises that why should I treat a fibroid? And what are the options? Now, to treat the fibroids today, we have basically options like medicines, injections, surgery. But what you need to remember is when is it that you need to get treated for it? So if you're having heavy bleeding, if you're having pain, if you are unable to get pregnant or something or the other is going on and you diagnose that you have a fibroid, then you may require a treatment. The commonest treatment that we do for fibroid is to first allay your symptoms. Now, symptoms, as I said, we started with two symptoms in the beginning today. One is heavy bleeding, the other is pain. So we need to, as doctors, address to these two problems. When we address to these two problems, we treat you with painkillers, we treat you as simple medications which will reduce your bleeding, make you comfortable, and then we look into what is this fibroid and where is it located. So the location of the fibroid in your uterus can be towards the outer part or towards the inside. Now the inside ones are the ones that give you more trouble. Even in a small size, they may cause you more trouble, and that brings you to have some kind of surgery. The ones that grow outside tend to grow bigger and then they have a problem. So what do we do if we have a problem? Now, today we have many of these medications, injections that are there to treat fibroid uterus. But one must remember that these give temporary relief. They may also control your fibroid for a short time and then it can come back once the medications are stopped. So what's the permanent treatment for fibroids? The permanent treatment for fibroids today is actually surgery. I know when I say surgery, all of you get worried. Well, you must remember that surgery can be basically two types. Now, it depends upon what is your presenting symptom, what is your age, what is the background of reproductive function that you're looking at. That means, are you looking for more pregnancy or not looking for pregnancy? So all these factors come into play when we decide what are we going to do with your fibroids. So we have two options. We can remove the fibroid, save the uterus. That's called myomectomy. Then the other option is we remove the fibroids and the uterus together, and that's called hysterectomy. So it depends upon what is it that you're looking at that we decide what we need to do. However, once we decide that yes, medicines are giving you temporary relief, we need a long-term solution for your fibroids, what shall we do? We need to look into what is the size of the fibroid, location of the fibroid, and then decide what type of surgery should we plan. Now, as long as the type of surgery is concerned, we have basically two types of surgery. One is an open surgery where you all know we make a large cut, remove whatever we need to remove, and then close the prep. This is an age-old treatment called open surgery or laparotomy. and it's been happening for decades, is an effective surgery. It can give you the relief you're looking at. However, having a large incision surgery can give a little slow recovery, more blood loss, more pain in the recovery period, which most women don't want. We all want to get well fast, get back to our family, get on our feet, get back to our work that we have been doing. So for now, we have keyhole surgeries that we address to when you have to get surgery done for fibroids. What are these keyhole surgery? The commonest keyhole surgery that we talk about is laparoscopy. Now, laparoscopy is something which we do with small holes inside your tummy, look inside your tummy on a screen and then operate. And once we finish the surgery, then there are very small incisions. You may quickly go home and things like that. We have an advanced technology in this laparoscopic surgery today, as we call it robotic surgery. Now, robotic surgery is no robot. There is no Chitti, or there is no Ravan, or there is no other somebody like that. But that is a surgery which uses computer assistance. Now, computer assistance, how does it helping me? You'll ask. Well, if you look around you today, some kind of computer assistance is giving you benefit to do your day-to-day activity. The same benefit it gives me as a surgeon. So just look at a phone. You have a small phone which you could just press some buttons and make a call or receive an SMS. But today all of you are watching me on your smartphone. So it gives you much more options to do things, and that's what advanced technology is for surgeons as well. So this is how we go across and manage the surgery part. The second problem which we thought we will discuss today with all of you, and what we thought was endometriosis. Now, endometriosis, I'm not sure how many of you heard about it, but we must remember again, by and large, endometriosis is not cancer. Okay? It's a chronic inflammatory condition inside your body, especially close to your uterus and ovaries. Now, how does it develop? It develops because if you think this is your uterus, there's a lining inside your uterus which we call as endometrium, right? This lining grows every month and then bleeds when you have your periods. But remember that around the uterus, you have two ovaries, correct? Sometimes this lining tissue is available outside, and then it starts bleeding just the way you would bleed at a period, and starts collecting blood, which becomes like cyst, which we call as chocolate cyst. Now, this cyst that develops, we have a question, what is the first sign or symptom of fibroids? Well, mostly fibroids can be asymptomatic, but if you are having pain or bleeding is one of the symptoms. So this endometriosis that we were talking about is what starts developing in your pelvis. Everything gets stuck and you have pain. You may have heavy bleeding. But you know what the problem is with endometriosis? Sometimes it grows from a long time. That means there could be some part of this disease process developing right from the time you actually have your period starting. And most often when you have pain at that time, you just get ignored saying, oh, all girls grow up like this. You are going to have pain. Slowly it will stop. But this pain starts becoming more and more. So what you need to remember is there is actually a delay in the diagnosis of endometriosis. We understand as doctors that the delay is because of two reasons. One, that we ignore our problem. That means we have pain, but we think, oh, well, let's wait. It's something, I will get married, it'll get better. I'll have children, I'll get better. Or maybe our mothers, grandmothers tell us the same thing. So it is our ignorance that we don't come forward for an evaluation. The second is not your fault, is my fault, or the doctor's fault, or the people whom you are consulting's fault. That the symptoms can be sometimes so vague. That means you can have something that maybe it won't even strike that it's something to do with uterus. Okay. Now, there is some questions regarding whether it's a hereditary condition, whether you can have pain in intercourse. Yes, both these problems, fibroids and endometriosis, are hereditary. So if you have family members who have this problem, you can also develop, so be aware. The second, yes, both of them also can cause pain in intercourse, pain during periods. So again, if these are the symptoms, please connect to doctors and make sure they diagnose you. So coming back to why we are missing the diagnosis of endometriosis, the second one is that sometimes you may have vague pains, like you may have just bloating around the time of your periods. You may have irritability in your motion passage. You may have headache. You may have vomiting, nausea at the time of periods, and you may think, oh, this is just normal. But believe me, these are subtle signs for us to pick up that you may be developing endometriosis. The other problem is that all times when you develop these symptoms, we may not find that you have a scan or some test showing positive that you have endometriosis. So that becomes a dilemma for us to diagnose. But looking at your history, sometimes doing an examination, we do understand that you have endometriosis. Why are we talking so much about it? Now we are talking because if you develop or if you by chance have endometriosis, it's a lifelong problem. It doesn't go away. We may do some treatment in terms of some medicine, some surgery, but all through the life, it troubles you a little bit. So what is our job here? Our job is to give you a continuum of care. That means we cannot give you one medicine and say, okay, it's gone. Or we cannot do one surgery for you and say, okay, it's gone. It doesn't work that way. You and I have to work together to make sure that we take care of this problem throughout your life. And what we will do, they will depend upon what is, again, your age, what is your presenting symptoms, what is your desire, and what is it that you want us to solve. So if you come to endometriosis, what are the three main things that bother you for which you should come for treatment? One is pain. And what pain? Pain can be cyclical every time when you have your periods, or pain can be acyclical. That means without periods you are having pain. This pain sometimes can be unusual, associated with passing motion, bloating, headache, or something else in your tummy. And only clue here is that if these pain, which are difficult to understand, but they get more during your periods or around your periods, think it could be endometriosis. The second reason why you could come forward and we need to treat you, you are having abnormal bleeding. That means the uterus is enlarged, you are having too much of bleeding, every time you need to use clots and more pads, and you are developing anemia. Third reason is sometimes when you have problem in getting pregnant. That means you are wanting to get pregnant, but we diagnose that you are having endometriosis and you are having difficulty in getting pregnant. Last and not the least, in endometriosis, sometimes you develop very large cysts, and we may be confused whether it is cancer or not. So another question that's coming up saying, does the uterine fibroid has impact on pregnancy? Very good question, Nihal. Now, it has both ways. That means if you have a fibroid, it can possibly decrease your fertility potential. Having said, meaning that if you have fibroid at certain locations or certain size, removing fibroid may improve your chance of getting pregnant. But the other way, if you have a fibroid, that does not mean you can't get pregnant and continue a pregnancy. We have situations where people have fibroid, conceive and continue through the pregnancy. But what are the problems? Yes, large fibroids with pregnancy can cause preterm labor, can cause premature rupture of membrane, can cause some problem in pregnancy as well. But both are possible. So coming back to endometriosis, we were talking about why you need to come forward for treatment. And when you come forward to treatment, what are we going to do? All right. So first thing is to diagnose that you have endometriosis. Today, the gold standard, as we call it in medicine, or the most confirmed way of diagnosing endometriosis is actually to look inside your tummy through a laparoscope and say, oh yes, these are endometriosis. Take a small piece, confirm with biopsy and say, yes, completely, you have endometriosis. But many times that may not be possible because everybody does not want to have an laparoscopy at some point in time. So we have to make a clinical diagnosis and we start treating you with medication. What are the medications? Actually, if you understand endometriosis, the commonest medication we give is contraceptive pills. Again, Nihal is asking a question, does it impact the growth of child if pregnant? I had to miss and is due to lack of growth of fetus. Yes, if the fibroids are very big in your uterus and you are pregnant, sometimes there can be compromised space and that can give rise to some kind of growth restriction to the baby. So coming back to endometriosis, now what do we do? So the commonest treatment that we give are two. One is we can give you plain painkillers to control your pain during periods. The second is we plan or we like to give you contraceptive pills. Many patients ask me whether it will have any complications or whether it will have long-term side effects. But remember, contraceptive pills are in market or it's being used by doctors for over 50 years. And if we had so much of side effects, we would have banned it by now. So we use contraceptive pills in situations like you to control the amount of blood that gets lost during periods so that the endometriosis development comes back. It is also a kind of trial. If I give it for 3 or 4 months to you and you get better, then you actually improve in your symptoms. There's a question by Aarti saying, impact of endometriosis on menopause. Well, endometriosis directly does not impact the menopause, but endometriosis is an estrogenic condition. That means you have more estrogen in your body and that is why you are developing endometriosis. So as a corollary, we can understand that patients of endometriosis may have a little delayed menopause. We also understand that once you reach menopause, endometriosis will come down because now body does not have so much of estrogen. But it's not absolutely unusual to find some women have pain due to endometriosis even in their menopause. So as I said, endometriosis is a very tricky situation, both for you and for me to treat you. So remember that correct diagnosis, following it up through your life and making sure that you have some kind of treatment to control it is very important. Contraceptive pills, one of the best, we can actually continue that. The second we give is in case we have some special medicines and injections that can control. But these are all, it will be effective as long as we give you those medications. The second option that comes when we talk about endometriosis is surgery. The one most common reason for which we do surgery in endometriosis patient is to give you pain relief. So if your main concern is pain, that means you are suffering with a lot of pain every day and you are unable to do your day-to-day work or unable to even have sex or whatever, then laparoscopy surgery or robotic surgery will help you. There's another question, do we need to keep getting laparoscopy to remove fibroids? I don't understand, keep getting. You actually can remove most of the fibroids in one sitting by a laparoscopy or a robotic surgery. You don't have to go again and again unless you develop a recurrence of problem. Now, when I speak about recurrence, it is more valid for a problem like endometriosis, right? Endometriosis is a recurrent problem. In a ballpark figure, if I speak, 20% of patients have recurrence of endometriosis in 2 years after surgery if they go through a surgery, and 50% in 5 years' time may develop some part of endometriosis. So recurrence is a main problem, more a problem in endometriosis than in fibroid. So what do we do to prevent this recurrence? We do two things. One, we give you completely good medical therapy. And if we end up doing a surgery, one must have a complete surgery. I have got a surgery done 10 years back before getting pregnant. So obviously you got pregnant and now again the pain is back. So this is, I'm not sure, Nidhi, whether you're talking about fibroid or endometriosis. Looks more like an endometriosis. Yes, the surgery must have helped you to get pregnant. But what you must remember is you must continue some kind of suppressive therapy so that this problem does not come back. And that's what I was about to say. That when we advise treatment for endometriosis, we must remember that the surgery is should be complete. That means all endometriosis should be excised. Doing a surgery of endometriosis is a tricky surgery. It requires a lot of skill. It requires senior doctors to do it. It requires a good gynecological surgical to do it. And of course, you require a good infrastructure in terms of good laparoscopy or robotic system for me to see to be able to do the surgery well. So make sure when you are advised or when you think you need a surgery for endometriosis, you must choose the right place, the right doctor and the right technique to do these surgeries. It's very important because if the surgery is not complete, the second surgery does not give you the same result. First surgery has the best result and ideally first should be your last surgery as well. Once the surgery has given you an initial benefit, Remember, that's not the end of the day. You have to continue with some kind of treatment as you want to follow. So this is something which I wanted to share with all of you regarding endometriosis and fibroid. Thank you all for watching, and thank you all for asking so many questions. So hopefully today in this little short time, I have managed to give you some information. Would be very happy to connect any one of you at any time, or you could get my connection through the hospital and let me know. Neha again asks which technique is best. Where as far as the recovery is concerned, for both endometriosis and fibroid, you must, if possible, if the surgeon is skilled and the facility is there, go for minimal access surgery, which could be either laparoscopic or robotic surgery. So that would be my first choice. But in case you have a place where this is not available, we must to be able to even undergo an open surgery, you will get relief from your problem. Thank you. I know you are looking forward for an extended session. Me too. Today, I think it was a session for about half an hour. So we'll close here. Thank you all so much for watching. I really enjoyed talking to you all. Would love to give you more information anytime. Please follow it up with any questions that you have. Thank you. So I'm signing off now. Have a good weekend. Bye-bye.